Committee on Occupational Health and Development of International Commission of Occupational Health, and he is also the country leader of Integrated Health Services India and South Asia of IBM India Limited. Before that, he was chief in Reliance and in many other industries, and he has a lot of publication. As I told you earlier, if I go to net detail, it will take long time. So, Dr. Pingle, please.
Good evening. It's my proud privilege to be here with you, and I'm really overwhelmed with your campus. And of course, I cannot forget the fact that Indian Railways is the biggest employer in the country. So, with the scope of activity that you are having and the description which Dr. Ray gave just now about how you are running and various kinds of hazards that you are managing so well. So, I think you all know occupational health very well. So, whatever I speak would at the most be a revision to you, or may provide some thought for some food for thought. So, Dr. Siddhar and Dr. Gupta from IOH West Bengal branch, Dr. Ray, the Chief Medical Director, and my dear friends. I have chosen this topic, care without scare, for occupational health workers because I am going to speak to a group of doctors and maybe some other staff from the hospital. But actually occupational health does not differentiate. It does not differentiate between doctors and others. So there are 4 principles of occupational health which were taught to me way back when I started learning my occupational health, which I can never forget, and which generally I take every opportunity to revise them with whomsoever I am discussing occupational health. So the first principle says that every human being has an occupation. So for having an occupation, you don't have to come to Indian Railways, or you don't have to go to Hindustan Unilever, or you don't have to go to Tata Steel. Everybody, whosoever is there, has an occupation. Whether you are studying, whether you are working, whether you are retired, there is nobody who is without an occupation. And the second principle says that every occupation has occupational hazards. As Dr. Ray described, that it is not only the drivers and his supporter in the locos and in the trains that they have their hazard, but everyone has an occupational hazard. Even you people, you are working in the hospital, in the healthcare sector, we will deal with that a little later. You also face unique hazards and successfully manage them. Now, unfortunately, this occupational hazard, if we don't take any action on it, will lead to occupational diseases, and occupational diseases do not have cure. The clinical problems may have cure, but occupational diseases do not have cure. And you will find that I am starting on a very negative note, saying that everybody has an occupation, every occupation has occupational hazards, and occupational diseases have no cure. But there is also a silver lining, which says that all occupational hazards can be prevented wherever we are. So that is where we need to start with, that all occupational hazards can be prevented, should be prevented, have to be prevented. And for that we have to first know what are they. As we go along next half an hour, I will also introduce you to some of the people in the field of occupational health and public health, whom you may already know. So the first and foremost is, of course, Bernardino Ramazzini. He was an Italian physician who first asked the question, what is your occupation? Nowadays also, they ask the question, what is your occupation? Whenever you go to any doctor, especially in private practice, he would ask you, what is your occupation? But the intention is totally different, because based on that it will be decided what test you should undergo and how should you be. So his treatise on De Morbis Artificum Batriba, diseases of workers, is 300 years old, and is supposed is an authority and a father of occupation. So occupational health is physical, mental and social well-being in relation to work and work environment. So how everybody will have a different work environment, and when you are seeing, because health, we say WHO has defined health as physical, mental and social well-being, and not only absence of disease or infirmity. So because you do not see a disease, that does not mean you are healthy. The disease may have already started. So in the same fashion, it is the case with occupational health also, that you have to adjust well with your work environment where you work. There are various definitions of occupational health. I don't think we need to go into the details, especially when there is such an enlightened audience. But it is basically health problems which are pertaining to or arising from the work, health of people at work. And there is a relationship between occupational work and health. And there is environment, health, and when the relationship is not appropriate, then the result is accidents and diseases and all. These are the typical things about occupational diseases, that they have a long latent period. Once developed, they cannot be treated, but they can all be present. They can all be prevented, and that is where we need to act. But there is one peculiar thing about this, is what I had read in the book of Belles in Surgery when I was studying medical in the medical college 35 years ago, that what the mind does not know, eyes do not see. So you may walk past the same thing, but you will not notice what an expert will notice. Now this is, with this slide I will try to explain it to you. See, these are the various work-related injuries and diseases. And on the x-axis is the time which is taken, and on the y-axis is the cause, whether it is easy to see or whether it is difficult to see. And what do you see here? Fume fever. It happens immediately after you are exposed to heavy metal fumes. Especially that would happen in your workshops or in iron and steel plant, wherever there are metal fumes, a lot of welding and other things are being happening. So what do you see there? That the person will come back to you next day with a lot of fever. No, you will always miss it. You will always, because fever can come because of various reasons. It can come because of malaria, it can come because of viral fever, it can be a result of so many things. So how are you going to relate it with what he did and exposure to his work environment? Unless you know it, you cannot do that. Similarly, noise-induced hearing loss. Now it is definitely because of work, we know that when you are exposed to high noise. But that takes decades, 5 years, 10 years to develop hearing loss. And by that time the person is usually a little old also, so you will think that that hearing loss is because he is aging and not because of any other reason, not because of his work. So that's why it becomes very confusing. So unless you know it, you will not be able to identify it. Then there are various things like stress, which also take a long time and which are very difficult to identify because everybody is suffering from stress. Then there is diseases like lung cancer, leukemia and all those things which also take a very long time. But even in accidents it is very easy, you can correlate accident with the cause. But other things, they are very difficult to correlate with the cause. And that is the reason this becomes important. These are various hazards, physical, chemical, biological, mechanical and psychosocial, so I will not go into the details of it. But I will just briefly touch about various occupational health disorders. Now these you know, that these are the various routes of exposure: inhalation, what you breathe in; ingestion, what you can eat; and skin absorption. I will give you a very simple example. I think Statesman is a very popular newspaper in Kolkata, right? And Anand Bazar. So on a Sunday, because every day you all are busy, you may not get time, but on Sunday in the morning, when you are reading the newspaper and the breakfast will be ready and your wife will call you to have your breakfast, then you go and have your breakfast. But some of you may want to wash your hands. And when you wash your hands, what do you see? You see that though you have already taken bath in the morning, still when you wash your hands, a lot of black thing comes out of your hand. The water turns black. Why is it so? It is because of the printing ink. And that printing ink contains lead. Now how many of us realize that? I mean, it's there in front of us, but we do not realize it. That printing ink has lead, that lead can be absorbed. Lead can be ingested if we do not wash our hands and eat our food with that. And we Indians still eat with our hands. So this is just an example. Then when you go to the workshop or when you go to your machining and other places in railway, what you will see, there is a uniform. The uniform, how is the uniform? Usually the uniform is a full shirt. It's a full pant. It's a helmet on the top. Then there are safety goggles. There are safety shoes. Why all this? And then there is a mask. Why all these things are required? They are required so that the inhalation is prevented, the ingestion is prevented, and the skin absorption is prevented. So these are the things. And if you don't realize it, the reasoning, then what will happen is people will not wear. Then they will wear half sleeves. They will wear various fancy things. They will not come in uniform because they do not understand the reason for that particular attack. Again, there are 4 types. What we see here is there are diseases which are only occupational in origin. Because occupational health is not that simple. Sometimes it can become complex and complicated also. So there are diseases like pneumoconiosis or silicosis which occur because you are exposed to silica. Asbestosis which occurs because you are exposed to asbestos. But there are also diseases where occupation is only one of the causal factors like bronchogenic carcinoma. There are other factors also. So 2-3 things come together and then you get that disease. Then it can also become a contributory factor like in chronic bronchitis, which you are seeing a lot nowadays. There is a great increase in chronic bronchitis in various cities. Especially there is a relationship with the pollution, air pollution, motor vehicle pollution, traffic pollution also. And last but not the least, sometimes there may be a pre-existing condition like asthma which occupation will aggravate. Occupation will not cause it, but it will aggravate that condition. So these are the various things which we need to keep in mind whenever we are talking about occupation. And when it comes to occupational diseases, as I said, for every occupation, everything there is some or the other occupational disease. If there is heat, there is too much of heat as it has just started coming, you will get heat stroke, you will get burns. If there is absence of heat, that means if there is cold, then you will get frostbite. Nowadays there are many industries or many occupations like fisheries and all, wherein you have to work with your hands and you have to put the things, you have to use a lot of ice, refrigeration and all that thing, then you can get frostbite. Then where there is no light or not sufficient light in case of mines, you have minus nystagmus, or if there is too much of light, then you can get cataract, as you see in those who are working in the outdoor in the field for a long time. Then if there is pressure, lot of pressure, those who work underwater, then you get Caesar's disease or air embolism. Now, for example, everyone is trying to locate that ill-fated Malaysian Airlines flight. So, a lot of people are going underwater to look for the things. So, they would all be subjected to that. Then there are various physical agents. They can also cause diseases. Noise, we already talked. There is vibration, which can cause peripheral vascular diseases. So, you are all medical, so you know it very well. Radiation can cause leukemia and aplastic anemia. We'll discuss that little later. Then various injuries and accidents, of course, they are there with railways when people work with their hands and so much of things. Then wherever there is an electric shock, electricity is there, there will be electric burns, electric shock, all these things will be there. But about noise, I would want to just show you a very small clip. this means is basically your ears, they are irreplaceable, they cannot be replaced. Your toes can be replaced, other things can be replaced, but you can't do anything about it. And that's why all you need to do is to prevent. That's the message. I saw this wonderful clip, so I thought let me share it with you. Then various chemical agents and gases are there that you will find in your workshops also, like carbon monoxide, carbon dioxide, hydrogen disulfide, CS2. They are there in various industries. Dust like pneumoconiosis, silicosis, anthracosis, where there is a coal dust. Of course, nowadays your locomotives don't run on coal. They run on electricity or occasionally diesel, but it has been the bane in the past. Then there are various metals like lead, mercury, chromium, manganese. Lead is very dangerous. It's present at places, many more places than what we think of. Then there are various chemicals like acids, alkalis, solvents, etc. I think you all know this, so I need not go into the details of this. Chemical hazards, diseases caused by the dust, they are everywhere there. Then there are various biological agents, especially in various industries. Nowadays, this industry is also increasing. Then there are occupational cancers, dermatosis, psychosocial diseases, etc. All these things are there. Musculoskeletal problems are very important, especially in the kind of work where your people work, and of course in your own work also. And we see there are common sites, common musculoskeletal problems, and they would happen at these various places. And these computers have come in. So when they came in, lot of work got reduced. So people thought that we will have less work, less problems now that the computers have come in. But they brought their own problems along with that. And whether it is repetitive strain injuries, whether it is problems in the neck, shoulder, upper limbs, there are various fatigue and eye problems, bifocals, that is another thing. As you age, you need a different eye correction, different refractive correction for near vision and different refractive correction for far vision, so we are using bifocals. But for computers, you actually need trifocal because it is somewhere in between and not many people do that. There are various skin diseases. Low back pain is something which is very, very common. And of course, when you work on the shifts, then there are effects of shift work which will be there, which have been coming because of computers. So these are various problems. And this day is not far away. So repetitive strain injuries, again you have various clinicians into the audience, so I did not spend any much time in it. These are the common RSIs or repetitive strain injuries like carpal tunnel syndrome, cervical radiculopathy, pectoral myelitis, gangliosis, tendinitis, and there are many others, few others also. So this is in just some of the diseases or some of the disorders which I wanted to touch on. Now we should know a little bit about occupational health and what are the things that we see commonly.